Hello, we are Amanda and Yobelli from Sydney Uni, and we would like to acknowledge other members who have been involved at various stages of our project, including Dr. Jeffrey Rogers. Our talk today is about a project we began a couple of years ago with the overall aim of finding ways to better support our diagnostic radiography students' mental wellbeing as a means of supporting their professional development. Diagnostic radiography students have a unique role in patient care and can be considered to differ greatly from other health professions. For example, interactions with patients can be very stressful due to the unpredictability of pathology and patient presentations. Due to this, diagnostic radiography students experience challenges during clinical placement that affect their emotional wellbeing and capacity to learn. The three main research questions of our project were: what is the range and magnitude of emotionally challenging situations experienced by DR students during clinical placements? Students' narratives of emotional challenges during clinical placements and how can we support DR students? And finally, development and evaluation of interventions to support DR students before, during and after clinical placements. Today, we'll be presenting our results from our online survey and focus groups.
For our online survey, we had a total of 155 completed surveys returned. And from this study student sample, 75% of students replied to us that they had experienced an emotionally challenging situation during their clinical placement. And things like emergency and theta were highly ranked. And for emergency, for example, emotional challenges were considered to be due to the visual impact of patients' injuries, patients' vocal suffering, and also the fast-paced environment of the clinical setting. Theta was also considered to be a high-stakes environment, which pressure to perform in a multidisciplinary team getting to students. In terms of the type of patient presentations, the most common reported factor to impact students' emotional state were patients in suffering and vulnerability. So students indicated also that they didn't feel prepared for this, and they were often unsure what kind of strategies they could use to support themselves. And also most study participants indicated that in these situations, they chose to use a task-focused approach. So interestingly as well, working with radiographers who in the clinical environment act as the main role models and teachers were reported by students to be a source of distress. So, however, even though radiographers were the most commonly reported health practitioners who led to stress, this was only by a small number of participants. However, in these cases, students reported bullying and inadequate supervision as examples. In the second phase of the study, qualitative data was collected using online focus groups. 3 focus groups were conducted and we had a total of 13 participants. Students were asked in the focus groups to reflect on emotionally challenging experiences during clinical placements and to identify support mechanisms that existed or that could be integrated in the future to support students' emotional wellbeing. 4 themes were identified from this focus group data. We had adapting to the reality of the clinical environment, witnessing unprofessional behaviour, forming relationships, and expectations and responsibilities of patient care. The student narratives from the focus groups made it clear that diagnostic radiographers experience bullying in the clinical space. Examples of these were wide in nature and demonstrated mostly unprofessional behaviour by clinical staff. There was also a perceived lack of support from the university, as well as knowledge gaps that caused distress when attempting procedures on patients. There were also key areas of previous clinical experience that supported students' ability to bounce back from difficult times, suggesting factors of growing resilience over time. Students also reflected that a growth in confidence occurred with increasing knowledge and experience. So clinical radiographers and academic staff were reported to play a significant role in students' ability to navigate their emotions in the clinical setting. So students reported that when they had a good relationship with clinical educators, they felt supported during emotionally challenging situations. In terms of the strategies to support students in the clinical setting, students prioritised human interactions. Students were less interested in our suggestions for apps or online methods, as they didn't want to have to type in their problems into our website. They wanted a human to talk to and a human to support them. So this was suggested by a buddy system with other students or with greater university presence at the clinical sites. So at the moment, we are in the process of mapping resilience levels across all enrolment years as a way to inform us of some of these skills in our students. In 2021 and in the future, we aim to investigate interventions with a focus on human interaction where possible, and we aim to use a scaffolded framework across various years. And we are also concerned, of course, with ensuring sustainability of these programs. We're also in the process of setting up a co-design approach to make suggestions for interventions and enhance communication between students and the current systems that are available and any new support systems that we can create. Thank you so much, and please let us know if you have any questions or comments.